Hi everyone, my name's Gus and I'm a cosmetic and dental implant dentist. And I want to make a video to help people who are considering an all-on-4 treatment or a treatment where you're going in, having all your bad teeth removed, having implants placed and leaving with a full smile all in one day. It's commonly called all-on-4, although technically that's a Nobel Biocare term for it. Sometimes it's called teeth in a day, fast and fix, and every single implant company seems to have their own name for the same treatment. So the important thing to understand is there's a number of ways of actually providing this treatment, and the way that I do it may not be exactly the same as the way your dentist does it, but there'll probably be a similar kind of outline to the overall treatment. And even myself, I've changed the way that I do this treatment from 2-3 years ago to how we're doing it today. And even today, every single time we're doing it, we make slight refinements in trying to improve what we call the patient journey, how the patient is experiencing the treatment and the outcomes. We want to minimize complications. And when it comes to complications on this all-on-4 kind of treatment, I'll make a whole separate video about that, and hopefully I can get that shot and edited and out in the next couple of weeks, hopefully. So let's break my treatment sequence down into 3 kind of sections. First of all, after my patient has decided, yes, this is the kind of treatment that they want to do, they've weighed out all their options, all their alternative options as well, then we'll have 1 or 2 sessions for planning. Okay, and the way I plan it, I'm primarily a cosmetic dentist who does implant surgery rather than an implant dentist who does this all-on-4 treatment. So I look at everything mainly from a cosmetic point of view. My patients generally come in for an improvement in the appearance of their smile. So I'll aesthetically plan the case. We have to look at the lip support because quite often with a lot of missing teeth you lose a lot of lip support. So to rejuvenate the whole smile, we have to fill the smile up and support the lips. That's important. We have to have the width of the smile right for that person. We have to have the bottom edge of the teeth following what we call the smile line, so there's a nice gentle arc going upwards. And there's a whole bunch of other things that I'll take into account while planning the case. Now, quite often, if my patient has a lot of their own teeth, but they're in really bad condition, it's really difficult to do this planning stage because you cannot try in the set of teeth. If you're in a situation where you've got none of your own teeth, then it's easy. We'll have try-ins, what we call wax try-ins, where the whole smile is built up in wax, so we can visualize what the temporary teeth you get on the day are actually going to look like. So from experience, me and my lab, we have a way of communicating with photos. I'll draw over them and tell them where I want the bottom edge of the teeth to be, where I want the top edge to be, how I want them inclined front to back, and how wide we want the smile. So we'll take all of this into account, and my lab will prepare a full set of, effectively, they're just plastic dentures. So on the treatment day, we'll convert the dentures into what we call an implant supported bridge. So that's the first couple of sessions sorted out. Okay, they're normally about half an hour to an hour each, and we'll take all of our baseline records and do all of this preliminary work. Obviously, we'll take our CT scan right at the beginning to assess the bone level. I can then plan how many implants we're going to use. I can see, is the bone density good or is it going to be a bit tricky? And just get as much background information before we pick up a scalpel. Next, once we've done all of this, we're getting ready for the main event. Okay, so the main event starts at 9 o'clock in the morning, and we're usually out of the surgery by about 3 o'clock. Okay, and I tend not to do top and bottom at the same time. So if my patient is having top and bottom treatment done, I'll normally have the top teeth done, and then 2 weeks later we'll have an appointment to do the bottom teeth. Okay, so a little bit easier for my patients. It's a little bit stress reduction from a clinical point of view. I only need to worry about 1 set of teeth. So normally, let's say we're working on the top teeth. The procedure is pretty much the same for the bottom with a small variation. So we'll first of all go through all of our consents, all the paperwork, all the bad stuff that can happen with this treatment. Even though we've spoken about it before, on the day of treatment, it's always a good idea just to refresh everyone's mind to say, hey, look, bad things can happen. Sometimes the implants don't work, sometimes the bone is too soft. We've got a whole list of stuff that we go through. Then there's some medications. Typically for this kind of treatment, we will have painkillers, okay, usually just ibuprofen. We will give antibiotics, typically amoxicillin, which is a broad spectrum antibiotic. For those people who are allergic to that, there's other ones that we can give. And quite often I'll give some steroid called dexamethasone, and that helps keep the swelling down. It's not essential, and this is something I built into the protocol probably about a year ago. Next, after we've done the medications, everyone knows what's going on. We'll all scrub up. The whole team will scrub up. That means we're working in an aseptic environment, which is as clean as we can possibly have in a dental surgery. And we'll have the patient all completely numb so they don't feel anything. We give the anesthetic about 10-15 minutes to work because I don't want my patients to feel a thing. And after that's happened, we'll make our first cut. Okay, so I've got a way that we do this. The cut's made, the patient doesn't feel anything, and quite often there's a level of infection. These teeth have usually been affected by gum disease quite a lot. So the first 20 minutes is removal of all of the bad teeth and all the scar tissue around these teeth, all the infected bone and all the infected gum. Okay, because remember, we want to keep our site where we're putting these implants as clean as possible. If you're in a situation and you've got really bad gum disease, and this has only happened once or twice in the last year, then I might suggest that we, phase one, just take out the teeth, and then a few months later we'll put the implants in then. But in the vast majority of cases, we can open up, take the bad teeth out, level the bone, clean it all up, and start with our implants. I always work with the back two implants first. They'll go in usually at an angle so that we avoid hitting the air sinuses at the top, or at the bottom we avoid there's a nerve that runs which we want to avoid. And then once we've got those implants in, then my front two implants are pretty straightforward. They'll just go in. And then we put what we call the abutments, little connector rods on top of the implants, tighten them all down, and then we put something else over the top of it and then stitch up. Okay, so this is the worst part of the treatment for most people. This is the bit that they're scared of the most. In reality, they don't feel anything. If it is starting to ache a little bit when I'm working, then we just top up the anesthetic. You shouldn't feel anything. In terms of time, remember my patients came in at 9 o'clock in the morning, and by about 11 o'clock we finished all our stitches. Okay, so from this point onwards, it really doesn't matter if my patient is numb or not, because we're not going to do anything that's going to actually hurt. It's really just screwing and unscrewing things on top of the implants. And we need to do this maybe about 3 or 4 times. I'll have my lab technician in who's going to help me convert that denture which we made at the beginning into our bridge work that's going to be fixed into our implants. So we have to do a few things. We have to record the bite, we have to adjust the denture. There's a lot of adjustments going on, but it's not in the mouth. It's all done on the chair side. Then we try it into the mouth and then do more adjustments. From here on, from 11 o'clock until about 3 o'clock is how long it takes for us to process this denture. And by process, what I mean is have the connections put in which fit your implants perfectly. This is a really critical part of this treatment, and when I get implant failures, and they do happen occasionally, quite often it's because there has been some error at this stage. Not the surgical bit which we did in the morning, it's usually at this stage. Now, every time we get an implant failure, we look at why did it happen and try and modify our process to make sure that never happens again. And that's been working quite well for us. These days we hardly get any issues with this treatment. So by about 3 o'clock, usually between 2 and 3, depending on how smoothly everything goes, my patient's ready to leave. Okay, so from 11 till about 2 or 3 o'clock, we'll say if they came in with someone, they can come into the room. It's quite chilled out from this point to having the final teeth fitted. Once we fit the final teeth, I have to double, triple check that the bite is as even as possible on all of the teeth, and that when my patient's moving around and when they're chewing, the top teeth aren't restricting the bite of the lower teeth. Okay, in my complications video, I'll show you what happens when I didn't do this, okay? And once it was an oversight and it was a pretty dramatic failure, but we had a happy ending, nothing too bad happened. So that's it. Afterwards, the day after, the most common thing that people experience is swelling. Okay, there's usually not much discomfort. Okay, maybe a little bit. Sometimes maybe they have to take an ibuprofen or something like that, but usually it looks worse than it is. And swelling is by far the biggest thing that people experience. Now, bruising is on an individual level. Some people can have a lot of bruising. Some people can have black eyes. Some people can have this massive bruise which travels down their neck. It doesn't hurt, but it looks terrible. So I do warn my patients, just that's going to happen. And for about 10% of people, that is what happens. But it's nothing to be worried about, and it all just fades by itself within about a week. 2 weeks after surgery, we always invite our patients in. The kind of stitches I use don't dissolve by themselves, so we have to take those out. This is about a 15-20 minute appointment where we'll take the bridge off, make sure everything is nice and clean underneath there. If it's not, I'll educate my patient on how to clean the teeth so that they can do a good job at home, and we'll take the stitches out and pop the bridge back in. Okay, and we just leave it then pretty much for about 6 months. The only time I invite my patients in again and again is if the cleaning isn't good enough. I need to work with them to help them to be able to clean more effectively under this bridge. After the 6 months and we're happy that the implants are fully integrated into the bone, there's not going to be any more movement in the gum, now we start the process of making the final set of teeth on the implants. And this is really, there's no anesthetics involved, it's just screwing and unscrewing things. It's very similar to having a denture made. We'll take molds of the teeth, then we'll take more molds of your teeth, then we'll record your bite in different ways, then we'll have chances to try in what the final smile will look like. We can change the shape of the teeth, we can change the color of the teeth, we can change how long the teeth are, we can improve or reduce the amount of lip support that we need, all customized to that individual patient. And once we're happy with what the smile looks like in wax, I'm happy with the way that the teeth are actually biting together, then we process it, and the next time my patient has a final set of teeth made in a strong material designed to last many, many years. And then a week later we'll invite them back in just to review, make sure everything is okay. As long as the cleaning is good and my patient is 100% happy, we'll then set them off on a kind of a recall where I'll see them probably once a year, take x-rays, take the bridge off, make sure cleaning is good, and put everything back together again. Okay, so if you are considering this kind of treatment, I hope you found this video useful. Remember, not everybody does it in exactly the same way. Everyone's got their own preferences and variations on it. But this is the kind of way that I've found works really well in my clinic. And even for the dentists who refer to have me do the implants and they can do the final bridge afterwards, this is literally how we all work in pretty much the same kind of way. Okay, so as always, questions, comments, you can pop them below this video. I'll try and get back to everyone, and I hope you have a great day. If there is anything I can help you with, pop it in the questions, and if enough people ask for it, I might make a video on it. Okay, so take care.